Arizona, like many states, has long grappled with the challenge of helping individuals meet basic needs such as food security and stable housing, often through a fragmented and complex support system. But change is underway in the Grand Canyon state. Through a groundbreaking statewide initiative called CommunityCares, Arizona is making whole person care more seamless, accessible, and effective.
Here in Arizona, we recognize that health is more than just healthcare. Healthcare, traditional medical care, is critically important, but we realize that in order to serve the health of our member population, we need to do more than just medical care. And that's where the Whole Person Care Initiative comes into play.
What happened that actually generated the idea around CommunityCares is that the Medicaid agencies, some of the local foundations really brought the healthcare and the community together in order to discuss what the issues were around getting individuals connected with their non-medical needs and getting their non-medical needs met. And through those community conversations, the linkage between what everybody was saying is the need for common technology and the need for data to be collected and transmitted electronically. The point of CommunityCares is to have a technology solution that allows healthcare providers and community organizations to assess the needs of an individual and then connect that individual with the community resources that are available and to better coordinate ensuring that the individual receives the community resources that they may need.
What led to the success of the implementation of the CommunityCares program here in the state of Arizona was an incredibly collaborative effort with 3 different agencies here in the state, not only with Access, Contexture, but also us as a technological solution in Unitas, working together to create the infrastructure and implementation of the vision of how we help coalesce the entire community.
At its core, CommunityCares is a statewide closed-loop referral system platform. Its intention is to reduce the silos that exist within the healthcare system and between community-based partners and community-based organizations.
So we've onboarded over 1,300 organizations at the site level. We've impacted over 65,000 Arizonans across the state. And we've also seen a really high growth in volume over the past few years as well. We've seen over 140,000 referrals made through the platform. So we're really seeing that growth across the network and really seeing those partnerships in the community.
When I went through my struggles, it was always call an 800 number, and 99% of the time nobody answered. Being able to send a message on the platform and being able to get a response, even if it takes 48 to 72 hours, it's faster than waiting on the phone for never getting an answer.
So through the platform as well, we have helped our adult clients and families find jobs, because some families have employment needs that are not being met, and we do know how hard it can be to find a job. So we have a community partner that's actually on the platform. And through the platform, again, we're able to minimize that frustration of going door to door. We're able to submit the paperwork that's needed, that agency's able to accept it through the platform, and voila, they're enrolled in the program. And we've had success stories from them finding jobs through those programs.
We do have some needs for substance abuse. We had sent outside of Unitas referrals to a couple of different entities who had declined due to the patient's comorbidities, the patient's status. Patient wasn't 100% ready to change, was almost there and just needed that support. And through the Unitas platform, we were able to connect with a company, a local company actually, that takes on some of those harder cases and really spends the time to talk through that patient rather than diving right into, this is the plan of care and this is what we're going to do. And so we've had a couple of difficult patients. We've had success with their substance abuse due to this partnership.
I had a mom who came in and she's recently a single mom, and she, as a kid, she's looking for resources, and she, was able to fill the meds for her kid. And she's like, this is gonna sound like a weird request. Do you have any legal help? And I was like, actually, boom, yes I do. Here you go, connected, right?
It's one of the coolest things about the Unitas platform is how nimble it can be, and the fact that providers can take the out-of-the-box solution and implement it around whatever workflow works best for them. We use CommunityCares to
really enhance the care coordination and the discharge planning that we do at the hospital. We're able to assist using the platform to identify other providers in the community that are in network and can address those needs specifically for our patients.
One of the best ways to keep members out of a hospital or to keep their needs from increasing or their risk from escalating is to provide those non-medical services. So we measure this through, does a provider involved in a member's care keep them out of the hospital, keep them in their homes, keep them food, clothed, employed?
Our case managers aren't tasked with maintaining their own binders or folders of resources. They're able to rely on a platform that's proven to have real-time data. If you've worked in the field, you can know that just doing the research to find out where someone might benefit from a service can take a lot of time. When you're freed up by 30 minutes or an hour every week, that aggregates, and that is usually transitioned to time that we're spending with members to ensure that they understand what we're providing for them, that they know the benefits, the risks of not following up. Our case managers certainly benefit.
I remember when I first started, I'm just Googling stuff, putting in their zip code and just starting to Google, or jumping on Psychology Today and putting in their address. And now with this closed loop system, it's immediately giving me a really good list of people that are close by. It tells me how far away they are. It tells me what services they offer. My average case manager right now is managing between 70 to 100 patients in 2 weeks. There's also got to be some efficiency to it, and this has greatly increased that efficiency amongst our social worker case managers in getting care for patients.
So we can actually help support other community-based organizations to think through how to streamline their workflow, to how they could provide that care in real time, or even be able to close the gap in a more streamlined approach. Something that might have taken them a week or so now may even just take 24 to 48 hours in their ability to measure and track those outcomes.
As seamless as checking my emails, and I'm not sure how I would do my job and make sure that I meet all of the numbers that I need to. We have no problem meeting all of the needs of our grantees because we have all of these referrals and all of these connectors that we can make sure that we meet people where they're at.
More Arizonans than ever that had their needs met and connected to care in real time. And what we're looking at here in regards to the growth and the scaling of this incredible initiative is to continue to foster those relationships, cultivate relationships in community, bring people together to continue to coalesce around this incredible effort to get people connected to care in real time.
You know, if you're not on the network, join. It's another opportunity to serve folks who are in need. It's growing. We've seen great success at CPR. We're happy to be a part of it and advocate for it, continue using it. Hopefully, as it continues to grow, it will be an industry standard where folks are able to come together to serve the greater good, the greater need.
Community engagement is everything in this work. Our community partners are essential to the success of the CommunityCares platform. Without them, there would be no one to use the Unite Us infrastructure. There would be no one to do the great work that they do every day when they are meeting the needs of our members, of our citizens here in Arizona.